Welcome, everyone, again. Thank you for joining our January Healthy New Moms webinar. This is the first of 2026, so I'm super excited for what we'll be talking about today. My name is Roni, and I am the Child and Family Program Manager at the Mental Health Association of Maryland. And this webinar series is just to raise awareness about all things maternal mental health. So today's session is being recorded and will be made available to you in the coming week. We'll drop the link in the chat later on, but certificates of attendance are available and more information will be shared at the end. So, as we approach the 2026 legislative session, this webinar today is especially timely. Decisions made in these next coming months will directly shape how Maryland as a state supports mothers, infants, and families. And today's discussion is going to highlight an area where policy, practice, and prevention intersect, which is perinatal mental health. Mental health conditions during and after pregnancy can have serious and lasting effects on mothers, infants, and families. Yet 50% of mothers experience perinatal mental health conditions or disorders, are never identified and treated. Today's webinar will explore the current gaps in identification and support. It'll highlight MHAMD's Children's Behavioral Health Coalition's advocacy efforts, and we'll discuss policy and practice solutions so that we can best support moms. Our speaker today is our very own Ann Geddes, has worked in the field of children's behavioral health advocacy for the last 20 years, first at the Maryland Coalition of Families and currently at MHAMD. She serves as the Director of Child and Older Adult Policy, and in that capacity, she chairs the Children's Behavioral Health Coalition, which brings together a wide range of advocates with a focus on policy issues and concerns specific to children and youth with behavioral needs. During the Maryland legislative session, Ann is active in Annapolis advocating for or sometimes against bills related to behavioral health, especially those most relevant to children's behavioral health. She also serves on numerous statewide policy committees. So, Ann, thank you so much for being here, and I will pass it over to you.
Great, thank you, Roni. Hi, everybody. Happy New Year. I do have some slides for today. Are those going to be displayed? Here they come. Yeah, so this presentation is on perinatal mental health advocacy. It is something that we at Mental Health Association of Maryland have been involved with since probably 2015. And we keep chipping away at it. So I'm going to talk some about the topic and then about some advocacy efforts that have been done over the years and are ongoing right now. If you want to go to the next slide. So for those who don't know, perinatal, I didn't know this when I started this word. Perinatal refers to the time period of pregnancy through first year postpartum. The statistics are pretty startling. 1 in 7 women will experience depression either during pregnancy or that 12-month postpartum period. More than 400,000 infants a year are born to mothers who are depressed. And anxiety disorders are almost as common as postpartum depression and often coincide with depression. And the language that's sometimes been used around this is perinatal mood and anxiety disorders, PMAD. That basically, the two major mental health concerns of the perinatal period are depression and anxiety. There are obviously other mental health disorders that can occur that are associated with the perinatal period, but they are a lot more rare. Perinatal psychosis and other disorders that will manifest for the first time in a woman's life during this period. But depression and anxiety are certainly the most common and those that are most talked about and that I will be talking about here today. Next slide. So Roni mentioned the statistic. I mean, again, it's really troubling. About half of mothers who experience perinatal mental health disorders are never identified. And it's been said that it's the most underdiagnosed and untreated obstetric complication in the United States. And we tend to focus on all the other obstetric complications. Mental health often takes a back seat, is less of a priority. But as we'll see in the next couple slides, it's really just as important. So next slide. So potential consequences. So there are consequences on the mother, and there are consequences on the child. And first of all, the mood disorders during pregnancy for the mother has been associated with um, multiple adverse experiences. Only some of them are listed here. Increased nausea and vomiting, low maternal weight gain, they go together. Increased rates of preterm birth, increased rates of cigarette, alcohol, and other substances. And what's somewhat surprising to me was just a worse health status, including higher rates of preeclampsia and gestational diabetes, and there are others as well. So it's not something to be ignored. It can have a really significant impact on the mother. And then next slide, also on the child. There are multiple adverse outcomes that have been associated with poor perinatal mental health in the child, and that is slower language development, difficult infant temperament, poor attention regulations, and emotional and behavior problems. And this can follow a child through the years, cognitive and motor development, and then increased risk of the child developing anxiety or depression later in life. So it's a real problem. And because there's an awareness, and this was brought the, um, these adverse outcomes, and the high percentage of women who are never identified and treated was brought to the attention of the General Assembly by advocates back in the 2014, um, and they got legislation passed. So next slide. Yeah, so 2015 legislation was passed unanimously in the House and Senate and signed into law. And at the bottom of this slide is a link to that bill, SB 74, House Bill 749. The legislation actually sort of established this task force to study maternal mental health, and it charged the task force with multiple things they were to examine and make recommendations on. I only listed a few here because for the in the in concern about time, and also just, I guess, the main things we really want to focus on. But I encourage you, if you're interested, there's the link to go back and look at that legislation. They did ask the task force to make multiple recommendations. But I think the main ones are to recommend prevention, screening, identification, and treatment strategies for perinatal mental health conditions, identify and recommend EBPs, for healthcare providers, and then make recommendations to the legislature on bills that were needed, any policy initiatives, and funding to address the mental health needs in Maryland, of women in Maryland. They met, the task force met starting in 2015 through 2016. Dan Martin, who's now the Senior Director of Public Policy at Mental Health Association, was very active in getting this bill passed. And then he served as staff to the task force, and convened the meetings and brought in experts to do presentations. And he ultimately wrote the final report of the task force in 2016. So you can go to the next slide. So again, there's a link at the bottom of this page to the recommendations of the task force, and that 2016 report that Dan wrote. It also has multiple recommendations, And if you're interested, I encourage you to look at them. There's some really excellent recommendations, like about substance use programs for women, women and children, um, new moms with infants, substance use treatment they need a special kind of facility to address their needs. All sorts of recommendations about treatment that would be really beneficial, services that would be really helpful and unique to this population. But again, so I just pulled out some here because these are kind of the ones I wanted to focus on today. So increased screening and patient education, just it comes up again and again. It was listed in the legislation, the 2015 legislation, that they were supposed to, the task force was to make recommendations on screening and patient education, and then develop continuing maternal mental health education for providers. And again, providers who interact, women of the wording in the task force report is women of reproductive age, but we're talking about obstetricians, doulas, nurse midwives, pediatricians, all these different um, medical providers who work with who interact with women. They all need continuing education. And then one of the also key recommendations was to expand the psychiatric consultation program for, again, that spectrum of medical providers to pregnant and postpartum women uh, to address their emotional and mental health needs. Um, Again, more recommendations. I encourage you to look at that report if you're interested. So next slide, based on the recommendations of the task force, legislation was introduced in 2017, requiring the Department of Health to do several things to implement the recommendations of the task force. One of the requirements for the Department of Health was to develop an accredited continuing medical education program for providers, to identify perinatal mental health disorders. As far as we know, have we been able to find out that has not been done? And if anybody in this webinar knows of any effort that was done there, we have not been able to uncover any. So I'd appreciate, we've been digging and can't find any materials there, any continuing medical education. That is the link at the bottom of this page to that bill 775 from the 2017 legislative session. It requires several things, but the main ones are listed here. So the number one is continuing medical education. You want to go to the next slide. Number two was to work to expand BHIP, the Behavioral Health Integration and Pediatric Primary Care Consultation Program, to assist providers. And I don't know if any of you are aware of BHIP. It's been around for at least a decade. And it serves to link pediatricians with mental health professionals, psychiatrists for consultation. A lot of times we know that families families are very comfortable going to their pediatrician or primary care provider, taking their child in that space, and they're not so comfortable going to like a mental health clinic for specialty care. So one of the ideas of BHIP is that a pediatrician can get information needed to provide to a family or to treat a child without having to refer them to a mental health specialist, to be able to provide that care in the pediatric setting. And that's kind of similar to the collaborative care model, which is something that the Mental Health Association also has been advocating for years, providing that linking primary care providers to mental health specialists both in a consultation role and also to provide some treatment. So BHIP's been around for a decade, and this legislation said that the Department of Health should expanded to also assist pregnant and postpartum women. And if you recall, going back a slide, that was one of the recommendations of the task force, was to develop a consultation program for providers of pregnant and postpartum women. So that was in this legislation. The Department of Health wrote a response to this requirement and said that they didn't have the funding to expand BHIP to assist providers of pregnant and postpartum women, and nothing really has been done with that since that. The department said we don't have funding, and so nothing was ever done. Next slide. Third requirement of that piece of legislation was the department was to identify up-to-date evidence-based information about perinatal health disorders, and that information they had to provide to healthcare facilities and healthcare providers and post that information on the department's website. Again, as far as we were able to determine, no information was developed to provide to facilities and providers. And we looked at the department's website, and I waded through it, and the only thing I could find on the Department of Health website was under Maternal and Child Health Bureau. There is a tab that says Maternal and Perinatal Health Program, and under that there's a tab that says Resources for Pregnant and Postpartum People, and the only resource listed under that tab is the number for the National Maternal Mental Health Hotline. So on the Department of Health website, there's really next to nothing regarding perinatal mental health, despite this requirement in the 2017 legislation. And this is not actually uncommon that the legislature will pass bills requiring any department of Environment, Department of Health, Department of Human Services, and it just doesn't ever seem to get done. And advocates have to kind of keep harping at it, keep bringing it back up and trying to affect those changes. So next slide. Now, the Mental Health Association has a public policy team right now that consists of me, Dan Martin, the Senior Director of Public Policy, and our CEO, Linda Rains. We work with the legislature, government officials to affect laws and policies. And the public policy team chairs 3 separate coalitions: the Behavioral Health Coalition, the Children's Behavioral Health Coalition, and the Mental Health and Aging Coalition. Dan Martin chairs the Behavioral Health Coalition, and that is the large group of a wide range of diverse stakeholders, lots of providers, advocates. The coalitions do not include government folks because they're about advocacy, and sometimes government folks have trouble engaging in advocacy. They can get in trouble. So we limit membership to again, there are providers, advocates, hospital association, lots of different nonprofits. And then I chair the Children's Behavioral Health Coalition and the Aging Coalition, because we really there's this recognition that children and older adults kind of get marginalized. A lot of the bulk of the effort kind of in developing a system of care, mental health, behavioral health system of care, is to that basic adult population, and children and older adults have unique needs. There are different services, different evidence-based practices that work for those populations. So they require separate advocacy effort. So next slide. The Children's Behavioral Health Coalition, typically I've been on that coalition for since it was started, which I think was like, I don't know, around 2015. And typically the Children's Behavioral Health Coalition has really focused on younger children and adolescents, the needs of younger children and adolescents. We've talked about crisis services, developing a crisis response system that's unique to children and families, the mobile response and stabilization services. model. We have worked on voluntary placement agreement, improving that process for children, typically again, older children and adolescents to access residential treatment if that's needed. We've worked on expanding school-based mental health services through the consortium on coordinated community supports, which was established in the Blueprint Bill. Again, all these are really a focus on older children and adolescents. And you know, when you're focusing on older children and adolescents, it's almost like it's almost too late. But by that time, a lot of youth have developed really significant intractable problems, seemingly intractable problems that can be very difficult to address. And we kind of thought, why don't we start to focus on infant and early childhood mental health? Um, you know, get right out the gate, try to get families and children the help they need. And as we started to focus on infant and early childhood mental health, and part of that has been involved, I don't know if you're familiar with the 1915 that is a wraparound program that the Behavioral Health Administration developed. That is really not does not address the needs of very young children. We've advocated that the 1915 expand service array to address the needs of children birth to 5. We've advocated for treatment without a diagnosis because especially that birth to 5 population, it can be really challenging to diagnose and really counterproductive to label a 3-year-old with a DSM-5 diagnosis. So we've done work in recent years on early childhood mental health. And clearly that, just based on the slides that I was showing earlier, early childhood mental health is closely intertwined with parental mental health. You can't really address one without addressing the other. So even though perinatal mental health kind of lives in the adult world, it maybe should live in the full behavioral health coalition. It really seemed to make the most sense for the Children's Behavioral Health Coalition to take this issue on and advocate for improved services and supports. So our 2026 policy agenda, which we just developed at the end of last year, makes specific recommendations that are from that task force, that 2015 task force, about expanding information and resources for mothers and families at various times, pregnancy and postpartum, improve screening, and enhance training for maternity care providers and pediatricians. So that's in our policy agenda. Going back to legislation that really didn't get enacted earlier. So next slide. So we met with some delegates and Senator Guile, who Delegate White Holland is actually a new mom herself and really has an interest in this issue. And she said, I would like to sponsor a bill on perinatal mental health this year. Senator Guile is also interested. So they've been meeting with a group of stakeholders to determine what that bill should look like. And we've looked also really closely at what other states have done around this issue. And in some cases, just completely wholesale used the language from other states in their laws and put it into this bill. So the first component of this bill is, again, requiring screening, prenatal and first year postpartum. And the bill requires Medicaid and commercial insurance plans to reimburse for screening and encourage providers to refer to treatment women who screen positive. That legislation has been introduced has been adopted in California, West Virginia, and Minnesota. And we've had some conversations with both maternal providers and pediatricians about the screening requirement. And we've heard a few things. We've heard that screening is either not reimbursed or is reimbursed at really ridiculously um, low rates, that it hardly makes it worth it. And not only that, a lot of the providers have said, if I screen a woman and she screens positive, I don't know what to do. I don't know where to refer them. I don't know what resources are available. So screening just by itself doesn't really do much. Providers obviously need more. Next slide. And then so the second bullet here on this slide is training for providers. So there should be free maternal mental health continuing education trainings for providers. There are 3 states that have implemented that legislation, and it's clear that it shouldn't just be training about maternal mental health conditions. It should be about what are the referral pathways? How can you refer a woman? What resources are available to them? Is a huge part of that, of any training. And that was what providers told us they especially needed education on. And then going to the first bullet, this bill would require patient education, easy, relatively easy to understand information about maternal mental health conditions and resources that are available. Several states have adopted that requirement. And also interesting, when we were talking about improving patient education, it needs to be provided at various times in the prenatal and postpartum period. Some new mothers said that when they went home from the hospital, they had a binder that was like 2 inches thick with all sorts of information, and they're caring for a newborn, and I can't even begin to read any of this information. So it's important that it be provided at multiple times at various times in the perinatal period. Next slide. Oh, go back a slide. So go back if you can. So what I want to say about this legislation, Delegate White-Holland and Senator Guile, the legislation has been drafted by them and their staff. It's been sent to bill drafting to put it in correct statutory language. We expect that it's going to be pre-filed, and pre-filed bills should be coming out this week. So it could have a hearing date in 2 or 3 weeks. So we want all the advocacy we can get to further this legislation. Next slide. So how do you engage in advocacy? So I encourage anybody who has any interest in this issue, maternal perinatal mental health, or any other behavioral health issue, to sign up for the Mental Health Association's bill list and legislative alerts. That link on this page takes you to our web page, where you can sign up to receive that information. And that's how you can track, when a bill has been introduced, it gets assigned a bill number, and then it gets assigned to a committee, and then it gets assigned a hearing date. So without having to wade through yourself the Maryland General Assembly website, we pull out the most relevant bills to behavioral health, and this bill will certainly be on that bill chart. And then also on that web page, there's lots of different information about effective advocacy, either through phone calls or emails or visiting a legislator in person. Just lots of resources there that if you're interested in advocacy, you might find really helpful. Next slide. So also, along with going to that page and signing up for our advocacy alerts, Mental Health Association is hosting 2 events. Every year we hold a legislative briefing. This year is going to be February 16th, President's Day, at Graduate Annapolis Hotel. We have various speakers, lots of legislators present on their bills. This year we'll certainly ask Delegate White Holland to present on her bill, or Senator Guile. We have a speaker. This year our speaker is Doris Kearns Goodwin, who is a presidential historian. She wrote the book about Lincoln, Team of Rivals, and it seemed that given the current state of the presidency in this country, having a presidential historian present would be really of great interest to the population. So there's diverse things going on at the legislative briefing. It also includes dinner. And welcome anybody to attend who might be interested. And then also we're having a rally on February 26th on Lawyers Mall at noon. Keep the Door Open is we've labeled our advocacy efforts for several years. Keep the door open, because there's such a risk of losing behavioral health services across the state, across the country. Fewer and fewer people are entering the field. There's a real workforce crisis. Rates are perennially low, which keeps people from entering the field and causes high attrition rates. So we encourage legislators to undertake all sorts of different actions to keep the door open for people, Marylanders who need behavioral health care. Again, that website that has further information, and how to register for those two events. Next slide. And finally, if you really feel passionate about a bill, about a topic, you have expertise in that topic, I encourage you to submit either written testimony or testify orally, or do both for committee hearings. Maryland does not make this super easy to do. And that I think that's really unfortunate, because we really want to encourage as much public participation in the legislative process as possible, but it is not that easy to do. So as I mentioned earlier, if you sign up for our advocacy alerts, you'll weekly get the bill chart, which will tell you what committee a bill is being heard of and on what date that bill will be heard. If you want to submit written or oral testimony, you need to go to the Maryland General Assembly website, and there's a little tab there, My MGA, and you need to create an account. You cannot submit testimony or sign up to testify without registering for an account. And then you sign up on that account. To see the rules for testimony for the Senate, there's a link for the Senate committee rules, House committee rules. They used to be kind of different. Right now, I think they're pretty similar. You need to sign up to testify or submit testimony 2 days in advance of the hearing. You have to upload your written testimony in a PDF file, named a specific way. Again, it's way more complicated than it should be. And then go down to Annapolis. Most committee hearings start at 1. And when you go down there at 1, the chair will announce what orders they're going to hear the bills. The committee's going to hear the bills. They may be hearing 10 to 15 bills. Your bill may be first, bill may be 15th. And if it's 15th, you may be there till 7 or 8 o'clock at night. You have to be prepared to bring a good book to kill time, because you may be there a while. But it is really important, again, for the public to be involved in this legislative process, and for people with good information, expertise with these topics to give their testimony. So I encourage you to do that. And I think that's everything I have. Do you want to go to the next slide? Yeah. So are there any questions or comments? If anybody has information about some of these things I mentioned that we're unaware of, I'd really like to hear.
Thank you so much, Annan. You can also feel free to drop your questions in the chat and I can read them out as well. And also raise your hand on Zoom if that's preferred. Okay, I'm not seeing any questions in the chat. But thank you so much, everyone, for joining. Thank you so much, Anne, for this very informative presentation. I know I learned a lot, and thank you to the public policy team for all you all are doing, to advocate for families in Maryland. I want to also extend a special thank you to everyone that joined us today and that will watch this recording later on. You'll receive a follow-up email with the link to the recording and a survey asking for feedback so we can make future webinars even better for you all. Certificates of attendance for today's webinar are available upon request, and that link will be dropped in the chat for you to just quickly fill something out so that we can send that over to you. We're not able to offer CEUs at this time. If you're interested in serving as a guest speaker for an upcoming Healthy New Moms webinar, please click the link in the chat below and someone from the team will reach out to you. And it was just shared, but we are having a 2026 legislative briefing and reception on the 16th of February, and we encourage you all to come out and just see what is happening in the world of public policy. So again, we look forward to working with you all to support mothers and communities. If you have any questions, feel free to reach out to us at info.hnm@mhamd.org. Thank you all so much and have a great rest of your day.